Similarly, the vaginal ring and the patch have estrogen and progesterone as well, but of course that estrogen and progesterone are absorbed through the skin or through the vagina, and so sometimes the side effect profile is slightly better. With that vaginal ring, you remove it once a week and then you leave it out for a week at the end of the month. And the same thing with the patch, you replace it once a week and then you leave it off for the last week of the month. They have a similar immediate return to fertility, so really nice spacing options. The next group of contraceptives are the IUDs. So you've got two types of IUDs. You've got the copper type and then you've got the hormonal type. The copper IUD has copper in it, and that is a foreign body, and it activates your immune system, and it will have increased white blood cells inside your uterus, and it makes a sort of hostile environment, and so then your sperm will be killed as soon as it arrives in the uterus, and it can also prevent implantation. On the other hand, the hormonal IUDs will work by secreting a little bit of progesterone every day. We're talking about the Mirena and the Kyleena. The Kyleena and the Mirena both have the same active ingredient, but the Kyleena is like the baby sister. It's just a lower dose. So they thin the lining of the endometrium, and so they make your period a lot lighter and can sometimes stop your period altogether, which is safe. The copper IUD often makes your period slightly heavier and more painful because of that inflammatory response. So we only really recommend the copper IUD for patients who already have really, really light periods. So those are your two options. Again, if you remove them, you should have immediate return to fertility. On the rare occasion, some patients do experience some scarring in the uterus if it's been put in a traumatic way, or if there was infection in the uterus at the time. So it should be safe in most people, but that's not to say that it's not without its possible complications. The Implanon that goes in your arm, it can stay there for 3 to 5 years, depending on which one you get, is not that great of a spacer because it has a really long-lasting effect. So the Implanon and the injection both have high dosages of progesterone, and these contraceptives can linger in your body for up to 18 months. And so they can prevent ovulation, prevent your lining from building up. And so we in the fertility business don't love the use of those long-acting contraceptives because your fertility takes a really long time, can take a really long time to come back. But of note, none of these contraceptives cause infertility, but they can have an effect on the way that your body works. And so sometimes they are mislabeled as causing infertility when meanwhile they were possibly hiding a problem, hiding something that was causing your infertility. So know that these are safe contraceptive options, and it's important to speak to your gynae or your fertility specialist about which one is the best one for you. Thank you.